It's our second day in the Ufafa Valley. We introduced to Bafunani Mbamali, who lives here with 2 of her 4 children. Simangele is 3 years old, malnourished and in need of ARV treatment. Her mother struggles to make ends meet. I asked her if the other children also need medication. This morning she's going to the Home Affairs office in Iklopo.
Manje angibaholeli ngathini ngathi esikhathini esingaphambi ngangeke ngithola igrant walahleka ipasi ngabe ngisayithola yavesani yami.
Bafunani lost her ID when she was robbed 3 years ago. She's on her way to the Home Affairs office to find out if any progress has been made in sorting out her ID, which someone's used fraudulently. The 10-minute trip to Iklopo cost her 20 rand return, a fare she can ill afford. We follow her into the crowded local Home Affairs office.
Ngaphathi batheni i-ID akenziwa kusacutshungula inamba yayo lendala ngoba manje ngathi inkinga.
They kept telling her that they can't even issue the temporal ID just because her ID has got a problem. There's somebody else who's using it, so she can't move, she can't do anything. It's been a number of years and we don't know exactly what's going on. We are still having a problem here at Home Affairs. But in fact, I think I can't blame the local office here at Home Affairs. The one I can blame is the head office, the Department of Home Affairs, which is at Pretoria, just because they are the one who are responsible to issue the IDs for our clients. She was supposed to join the ARVs.
ARV treatment?
ARVs treatment, of which she didn't, because once you are applying to get ARVs, you have to have an ID. So, because she hadn't an ID, that's why she couldn't.
We checked this with the Department of Health. They said this is not true. The policy changed a few months ago. You can now access ARVs without an ID. But life-saving information like this doesn't always reach the people who need it most. To check whether clinics know about the changes, one of our team members pretended she had a relative and a child in need of ARVs who had no IDs.
So I get to work on a treatment as na pass the certificate. And hana le ID problem. But kuspekele not ID.
Clearly the message had not reached this clinic. Back in Iklopo, we visit Christ the King Hospital. Chief Medical Officer Dr. Riba Ngwenya paints a bleak picture.
Poverty is so ingrained in those communities because we see a lot of malnourished children. We see a lot of diarrheas, we see a lot of pneumonias. And when you find out why the patient couldn't come, the issue boils down to the lack of resources. They don't have money, there's no transport to reach us. Of the 1,400 kids that were admitted in 2006, about 8% died, and 50% of those deaths were due to poverty and HIV and AIDS.
That means that last year, more than 100 babies died, and more than 50 died as a direct result of poverty and AIDS. Child-headed households are common in the Ufafa Valley. Mahlentle is an orphan. She and her two brothers, aged 9 and 13, are in the care of an older sibling.
My name is Barentle. My surname is Love. I am 11 years old. I live with 3 brothers.
Just out of childhood himself, 19-year-old Satenjwa Ndlovo has become an instant parent with big responsibilities. He's also doing grade 12 this year. Both their parents have passed away. They lost their mother barely 5 months ago.
She passed away on 30 March 2007. She is sick very much. And my father, she passed away on 2000. My mother, she died on Christ the King Hospital. Nebe ngishiyake labazali kusho ukuthi mina kufuna azinake lezi ngane ngizingenise nasesikoleni ngizithengele yonke into ezidingayo ngale mali ekade ishiwo uma ekhaya.
Kundani of the Woza Moya project is trying to help Satenjwa getting financial support in the form of a grant. Satenjwa also has no ID.
He's the one who's leading the family right now because their parents have died. Currently, they are surviving with nothing. They are struggling with everything, and they are all at school, and they are needed to be there at school all of the time. And the problem in this family is that no one is responsible to help them. His parent left him without any identity document. So now he's struggling to just get in access to grants for his young sister and brothers. He did go to Home Affairs, and they mentioned that he have to come with the relative who's responsible for them. And he mentioned that there's no one in his family that he can go for it with them. And they just said, no, we want to have a proof. They didn't just look at the situation. They just want to delay and ask a lot of questions whereby these kids are in need. They have got no food. They've got nothing.